You have broken your ankle, and prior to making a treatment choice, we wanted to inform you of the different options to help you make a safe and informed decision.
Will I need an operation?
A broken ankle joint sometimes needs an operation to help it heal if your surgeon considers it to be unstable. If we consider the ankle joint to be stable, this may mean no surgery and the use of a cast or boot for between 6 weeks and 3 months normally.
If I need surgery for my ankle fracture, what happens first?
Your surgeon will recommend the best treatment options based upon how badly your ankle is broken. Sometimes your ankle can be out of place and your surgeon will recommend an anaesthetic to put the joint back. After that, you will require a plaster or something called an external fixator, which involves inserting metal pins into the bones of your leg. This is only for a few days, but it is a very important step to allow the swelling around your ankle to settle down. If you are offered an operation, this is to hold the bones in the best position we can get them in order to promote healing, early weight bearing, and function. This will involve 3 incisions around your ankle to allow the insertion of a mixture of screws and plates. We would normally expect to discharge you the day after surgery and would then see you at 2 weeks and at 6 weeks.
Do the plates and screws need to be removed?
We would not usually plan to remove the plates and screws, as this means another operation. However, should they cause problems in the future with pain or irritation, they can be removed.
Is this always necessary?
Your surgeon will inform you of the alternative surgeries and the risk or benefits of those options. It may be that not operating avoids scars, infections, and anaesthetic risks, but could give you a higher chance of problems with your ankle in the future, and your surgeon will warn you about that. We aim to give you the best outcome for your ankle following a fracture. It is, however, important to note that it is unlikely to ever be quite as good as it was prior to your injury.
Will I need to be in a plaster afterwards?
On average, you'll be kept in cast for about 6 weeks. For some patients, a further period of immobilization in a removal boot may be necessary. Following cast removal, your ankle may be stiff, swollen, and uncomfortable, and it may take up to a year or longer to achieve maximal recovery.
Are there any risks to surgery?
An operation on your broken ankle does incur certain risks. You will have a number of scars on your leg and may experience ongoing pain, stiffness, ankle swelling, and a feeling of instability. There may be damage to nerves and blood vessels, which may cause weakness, numbness, and a decreased ability in one's confidence to mobilize safely. Your wound or metalwork can become infected and require further surgery and antibiotics. Surgery carries a risk of developing a blood clot, which may cause a pulmonary embolus, stroke, or heart attack. Rarely, this may lead to death, and we may help to prevent this by assessing your risk and giving you additional treatment. As a result of the injury, you may experience a more rapid progression of arthritis within the ankle joint. Any fracture may either heal in a poor position, heal slowly, or not heal. In such cases, further surgery or techniques may be required. We would like to reassure you that we perform a huge number of these surgeries every year and are competent and safe to do so. Before signing any forms or having surgery, please make sure you ask any questions and we will be happy to answer them for you. We hope that your stay with us is as safe and as brief as possible.